Dr. Russell Samson joins us today to talk about carotid arterial disease and stroke prevention. Hello, doctor.
Hi.
Hi, welcome back.
Thank you.
We're talking about totally different things today, and arterial disease. And how does that cause a stroke? Is that it?
So this is carotid artery disease.
Okay.
So really what it is, it's the same thing I spoke about at a previous segment where you get so-called hardening of the arteries, same type of thing that you get in the coronary arteries in the heart that causes heart attack.
Okay.
Affects really almost all the arteries in the body, but one of the areas where hardening of the arteries is prone to develop is in the main artery that goes to the brain called the carotid artery. And just near this portion of your neck, under the jawbone, the artery goes up to the brain and one to the face. And at that juncture is, for some or other reason, a place where hardening of the arteries is prone to develop. And what can happen is the main artery to your brain, the carotid artery, can block off. The brain doesn't get enough blood supply and you get a stroke. Or a piece can break loose and go into the brain and cause a stroke.
And what causes hardening of the arteries?
Mainly that's fatty deposits, bad food that you've been eating, smoking, diabetes. We really don't know exactly what it is that causes it.
All right. Well, I know there's been treatments that have been used for a period of time, but you told me that you've developed a new treatment for this.
Well, I wasn't the one who developed it, but I was probably the first person in Florida to use it and one of the first in the world to use it. So the main treatment is medications. You want to try and stop the development of the blockage. So the same things like watching your diet, stopping smoking, get your diabetes, blood pressure under control. But once the blockage gets into the about 80% narrowing, the risk of stroke becomes very high. So up until now, the major treatment has been an operation that's called a carotid, that's the main artery, endarterectomy. So basically it's a long word, but what we do essentially is open the neck, open the artery, and just basically core out the blockage and sew the artery back together again. And in skilled hands by board-certified vascular surgeons, the results are very good. A couple of years ago, people started using stents, same type of thing that we do in the heart, and those are little metal scaffolds. But the treatment involved putting a wire in through the groin artery and then kind of maneuvering the stent all the way through the arteries, up through the neck into the neck. And the downside of that is during that process, little pieces could break loose.
Okay, so you don't do that anymore.
Well, some people still do, but what we now have is we make a tiny incision at the base of the neck, which can even be done under local anesthetic, and we put the stent in directly through a small incision right here.
Instead of starting down in the groin area. Oh my goodness.
So that gets rid of a lot of the problems about coming from the groin. But there's one other thing which is pretty unique to it. While we're doing this procedure, we actually reverse the blood flow out of the brain. So normally blood is going up into the brain. But we have a method of actually reversing it, so blood comes out of the brain. That doesn't do anything to the brain. The brain gets more than enough blood, because blood is coming up all the other arteries and still going into the brain. But in that one particular artery, instead of it going up, it's coming down. So if a little piece breaks loose while we're putting the stent in, instead of it shooting up into the brain like would have happened had we put the stent in through the groin, it just comes back out. And we have a tube that comes out from where we make this incision, and we run the blood back into a vein in the leg. So whatever breaks loose comes out and goes right back into your body, into a vein where it's completely harmless.
Amazing. Okay. And then once you're finished, then
we just sew it up, and the patient can go home the next day and resume driving and going back to work in 2 days.
Wow.
Really quite amazing.
Okay. Now, when you were saying that you developed this treatment, or I apologize, not developed it, but you were the first one.
No, I'd like to think I developed it.
But you were the first one to do it here. When somebody comes to you, like you said, you try to treat them first before you suggest having this done?
Well, we always try to treat blockages medically until they get into the 80% range. Now, there's some doctors that will operate at 70%, but usually we wait until it's 80%. Now, if you've had a little warning stroke, we may operate within 24 hours. But in someone who this is just picked up, usually with the medical doctor, he has a noise in the neck, or we get a test called an ultrasound. It's a simple, same type of test we look at a pregnant woman to look at the baby, but we look at the neck we can tell if there's a blockage in the artery.
Okay.
So if we then find that blockage and we find that it's more than 80%, we generally recommend treatment.
Okay, and is that the treatment you
Well,
recommend now? Or
up until now, we've been saying it's surgery.
okay.
But now with this treatment, based on the anatomy of the blockage and what the patient's preference is, we will offer this new treatment. And I think most people are going to try for it. Unfortunately, we can't do it in everybody. There's certain restrictions based on how the arteries actually look that will prevent us from doing it. But it is a very good option.
Okay.
But there are very few places that it's being done at the moment.
Right, and that's what I was going to say. I mean, you were the first one here in Florida and Sarasota to do it. I mean, there's not a lot of specialists.
Our group is very well known, not only here but across the world, for our treatment of carotid disease. We have been known to pioneer a specific aspect of the surgery. So when the company who developed this device decided to try and market it around, and it got FDA approved, they came to us as one of the first places to try it out.
That's amazing. We are so fortunate to have you, seriously, to have you here in Sarasota.
Well, I don't think people appreciate how fortunate they are to have the standard of medical care in Sarasota.
Across the board, I know we do have amazing, amazing doctors.
And amazing hospitals,
yes, and
with a
hospitals.
very high quality.
Right.
Yeah.
But
And it attracts good doctors to be here, and it attracts industry to come to us to utilize new cutting-edge tools and devices, which we can offer to our patients.
thank you. Well, thank you again for being here, and please tell our viewers your website for us, please.
www.veinsandarteries.com.
Okay, nice seeing you.
Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.